Welcome everyone to this presentation on the Alaska Peer Support Professional Certification Program. My name is Jerry Jenkins and I'll be doing the opening comments. On behalf of the Alaska Commission for Behavioral Health Certification and the Peer Support Advisory Board, thank you for attending this presentation today. I'll start with some administrative announcements and then do some introductions. Please use your mute function unless you're speaking. Also recommend, as Diana said, not using your video in order to help us save bandwidth. Last, use the chat box to record your questions. We will answer those at the end of the presentation when we have a formal question and answer session. So if during the presentation you're having difficulties with either the display or the audio, put it in the chat box because it will be monitored throughout. I'd like to take a couple of minutes at the beginning here to introduce the principals. This will include the Alaska Commission for Behavioral Health Certification and the Peer Support Advisory Board members who have actually done the work to put this presentation together. The commission is led by Dr. Courtney Donovan, who is the CEO of Aquila. Vice Chair is Rosalie Nadeau. Our Secretary is Clint Simic, and Clint is from Sitka. Rosalie and Courtney are in Anchorage. Our Treasurer is Dee Foster from Eagle River. Our longtime commission member is Jan Hotsey, and Jan is from both Juneau and Haines. I'd like to recognize her years of service. From Fairbanks is Montine Jackson. From Wasilla is Jenny Johnston. From ANTHC is Sherry Patro. And our traditional counselor is Audrey Sunnyboy. So those make up the Behavioral Health Certification Commission. So the advisory board members who did the work on putting together the presentation and the development of the credential that's being covered today included Jay Bechtel. Jay is the CEO of South Peninsula Behavioral Health Services. Also, Dr. Dave Branding, who's the CEO of JAMI in Juneau. They're representing the community behavioral health centers. From the Valley in Wasilla is Shannon Harris. She's the Peer Support Program Manager at Set Free Alaska. From Fairbanks and working at the Fairbanks Native Association is Bobby Dorton. He's representing mental health peer support workers. We have Lee Brenning. He's a behavioral health and wellness advocate who's an intensive case manager as well as a life coach and life manager. He too is representing peer support workers, specifically co-occurring and substance use disorders. Jen Galvin is the board chair. She's the Peer Support Services Program Manager at Alaska Behavioral Health, which serves Anchorage and Fairbanks. She's representing mental health peer support workers. Next would be Catherine Andrews. Catherine is Program Coordinator and Peer Mentor at the Alaska Mental Health Consumer Web, and she's representing family peer support workers. Let me go next to Jim McLaughlin, who you're going to hear next. Jim's the Behavioral Health Program Manager within the Division of Behavioral Health Services. Assisting also has been Eric Boyer from the Alaska Mental Health Trust, as well as Will Fanning, who also is a Program Coordinator at the Division of Behavioral Health. This group, and I'll call it an August group, was administratively supported by Marlene Johnson and Dabney Van Leer. So those are the folks that helped put this together, but I would be remiss if I didn't recognize Diana Carpenter and the Alaska Training Cooperative, who's helping us with the technical aspects of this presentation today and have helped us throughout. So thanks to them. We started this process with a kickoff back in May, and there's been 17, and I will say work sessions, because they have definitely been work sessions up till today. Participants have been impressive, and that's my opinion, because I was the liaison from the Certification Commission to the Advisory Board. There's been robust discussions. There's been novel thinking. There's been diverse approaches to how we get to a peer support credential in Alaska. And I will say this whole process has been done with a lot of heart. The group is diverse, but they demonstrated a remarkable ability to communicate, incorporate new information and perspectives, and reach consensus while working in an environment of mutual respect. And it's been impressive to watch. You will be seeing the result of their labor today. So as we prepare to introduce you to the peer support credential, let me do one more reminder. Please use your mute function. Recommend not using your video in order to save bandwidth. And if you have questions, put them in the chat box. We will be getting those during the Q&A session at the end. And with that, it's my privilege to turn it over to Jim McLaughlin, and he will introduce and present the advisory board recommendations. Jim?
Yeah, thanks, Jerry. And just a clarification on the chat. We'd like you to hold your chat questions until the end so they don't get lost at the very top of the chat. So this is the orientation for the peer support professional certification. And I just want to go back to the sort of history of how things have developed with the certification. In some respects, it started quite a long time ago. Peer support has been in Alaska for many, many years. But there was a point in time back in 2011 where the Peer Support Consortium, along with a number of other folks, including folks at the Division of Behavioral Health, worked to get peer support as a service into the state's Medicaid plan. That made obviously a pretty huge difference in terms of actually getting the workforce started in behavioral health agencies in particular. At that time, the Center for Medicaid and Medicare Services, CMS, wanted states that were doing that to develop a pretty clear education and training requirements or certifications for peer support providers. And the Peer Support Consortium did do some standard training, and they did that for many years, actually. But as time went on, peer support providers that were working in the field really wanted to get some acknowledgement and recognition for their skills and abilities as they were working in the field. And mental health and substance use disorder treatment agencies also really wanted to see a certification for peer support to have some assurance, particularly for folks that they were hiring, or even folks that were part of their workforce, that they possessed the competencies that they needed actually to do the job. More recently, in about 2017 or so, as the Division of Behavioral Health started to work on what's referred to as the 1115 Medicaid waiver, this was a waiver that's been allowed us to open up and create a lot of new services that weren't part of our state plan originally. That certification was something that the division wanted to pursue. Part of the reason for that was CMS was pretty oriented towards credentialing of individual workers that were going to be working with 1115 Medicaid waiver services. So back in 2017, late in 2017, actually, we had a really pretty interesting gathering of actually over 100 people for our initial stakeholder group for peer support. And mostly it was face-to-face. We had some virtual folks joining as well. But it was a group that included mental health peers, substance use disorder treatment peers, agency directors, mental health trusts, and other state leadership. It was really a pretty exciting get together. And part of it was really an opportunity for mental health peers and SUD peers to get together and really kind of see the commonality that they had and really sort of the potential for working together. So from that group, there was a creation of three different work groups. One of them was the peer support certification work group. And so that initial work group worked extremely hard over the course of 9 months, meeting every couple of weeks to create a set of core recommendations for the certification. In FY 2020, the division contracted with the Alaska Commission on Behavioral Health Certification to actually develop the certification. And a key part of this was to assure that at least half or more of the advisory board were going to be peers themselves. So what I'm going to go through here is really the work that this group did. It really sort of jumped off from the set of recommendations that had been made back in 2017 or 2018 actually, and then worked to actually put them into the form of a certification program. You know, in the intent with the certification was that we wanted to have a certification that was accessible to people, that had the ability for people to be certified without necessarily a lot of barriers to certification. But we also wanted to have a certification that had integrity. And part of what the original group back in 2017 had recommended was to have a certification that had multiple levels so that people had an opportunity to advance in their career and get recognized for that. So Jerry has done introductions already. Jerry was part of the group. He was very helpful along the way. He was one of the commissioners for the commission, actually. Dabney Van Leer, who's the executive director of the commission. Marlene Johnson, who's a program coordinator, is working specifically on the peer certification. And then the advisory board that Jerry has introduced already, we really benefited from a combination of both experience with peers that have worked in the field already, agency directors, and it's just been really a good group to work with. So here is the definition that the commission has used for a peer support professional. A peer support professional is an individual with the lived experience of recovery from either a mental health condition, from a substance use disorder, or from caring for a family member with such a condition. Peer support professionals deliver behavioral health-oriented support services to individuals with experiences similar to their own within an organization and under supervision. The peer support professional offers assistance and support to promote another peer's own personal recovery journey, and they're expected to share portions of their own recovery experiences in an appropriate and effective manner. So I'm going to go through some of the basic issues that we addressed in putting the certification together. The first was that the focus of the certification is on peers with a lived experience with behavioral health issues. This seems kind of like a no-brainer, but we actually had a lot of discussion about really the variety of different peer support. It's not just relegated to behavioral health, but through discussion, we were clear that the focus of this certification is on folks that have had a lived experience of either a mental health or a substance use disorder, and focused around that, and certainly can include families of individuals as well. The competencies that we used were the SAMHSA core competencies for peer support workers in behavioral health. And these competencies were put together in 2015 by a national group of subject matter experts in peer support. And they apply equally to both peers with a substance use history or peers with a mental health focus. We wanted the certification to be a general certification. There was really some discussion about whether we should break it down into multiple certifications for different subspecialties. But this is a general certification, so it should be able to be used by a variety of different types of behavioral health peers. And that can include peers with a substance use challenge, a mental health challenge, or their family members. It can also be used for behavioral health peers with a reentry focus, for behavioral health youth peers, or other behavioral health subspecialties. So the competencies in required training are basic knowledge and skills common to all peer support providers. It's really foundational. We also understand that with a variety of different focus that people may have with the work that they do, that there's going to be other types of training and skills and knowledge that people will want to pursue over and beyond what's part of this certification. But there was one exception to this, and this was really looking at the importance of peer support that's geared to the Alaska Native population. And so the board chose to identify a separate designation for traditional peer support that's largely the same requirements as peer support professionals. But we felt that there was a need to highlight that the certification was relevant to Alaska Natives in recovery from behavioral health issues, who provide support primarily to other Alaska Natives using traditional cultural interactions. So the original stakeholder group had recommended multiple levels of the certification. So let us go into those levels. The first level is peer support associate or traditional peer support associate. And this is very entry level with minimal barriers to actually becoming certified. Peer support professional 1 and traditional peer support professional 1 have an increased amount of training and work experience. Peer support professional 2, traditional peer support professional 2 has added training and experience required. And peer support 3 and traditional peer support 3 is geared towards folks that are capable of providing mentorship or supervision actually to other peer support workers. So as far as an age requirement, we knew that a lot of states did have a minimum age requirement of 18 years old. We know that a lot of agencies have that requirement as well. But the reality is that there's a lot of growth in the country with youth peer support. and young adult peer support. And so what the board chose to do was to not have a minimum age requirement. And agencies will set their own policies around this, but we really wanted to be open to youth peer support and not establish a requirement that was going to get in the way of that. In regards to educational level, again, we knew that there's a lot of individuals who are or could be excellent peer support providers, but haven't completed their high school diploma or GED. But we were also concerned that for peer support, there's documentation requirements that do require a certain level of proficiency with reading and writing. So the way that we approached this was that for peer support associate level, we would not have a minimum education requirement. But to advance to peer support 1 or the other levels, it would require a high school diploma or a GED. For traditional peer support, we realized that there were individuals that had sort of different challenges in terms of economic and educational opportunities. And so there's an option to for those individuals, if they need to request a waiver of that high school diploma or GED requirement. For lived experience in recovery, this was a really interesting discussion that we had on this. We were ultimately not wanting to come up with arbitrary definitions of what lived experience counted and what didn't. Obviously, we want individuals to identify that they've had a mental health or an SED challenge or been a family member. So we're asking people to identify through a self-attestation of their lived experience and in a minimum of 1 year of recovery. And so individuals be asked to describe their experience with recovery and the skills that they use to maintain it. And all the application levels will require at least one level of reference. So for training requirements, the foundational training requirement is a 40-hour introductory course to peer support. So from the original stakeholder group, it was recommended that the 40-hour course be based on the SAMHSA peer support competencies. And so what we did was we took those competencies and converted them into sort of required guidelines for the Alaska Peer Support Specialist Training Curriculum. And the division put this together. So there's an established guideline on what the training curriculum needs to entail. And so this training will be required for all levels of certification, except for some levels in the grandfathering or grandparenting application, which we'll get to later. So in terms of that 40-hour training, we have invited, and it's an open invitation still, for individuals that want to provide this training to submit their curriculum to DBH. Currently, those are coming to me. We review the curriculum and see that it actually addresses all of the guidelines that are required. And then if so, we will do a formal approval of that curriculum curriculum for that trainer. And currently, I believe there's 6 trainers, might be 7 at this point, that actually have approval. So in terms of getting the training, you need to make sure that the course is actually delivered by a trainer that has DBH approval for this curriculum. These trainings actually have been going on over the past 6 months or more. We have funding and we're in the process of contracting for additional trainings to be done the balance of this year, FY21, and then during FY22 as well. And of course, it's distance delivery at this point. And that was a concern that we really wanted to make sure that it was accessible to people in more rural areas. I think as COVID, subsides, that there'll be more opportunities for face-to-face training, but we'll still want to have a distance delivery capacity for it. So the 40-hour training is really sort of the core training, but there are some additional courses that are required as part of becoming certified. And that's a course in ethics, a course in confidentiality, and a course in infectious disease and HIV/AIDS. And these have to be done prior to certification. The ethics and confidentiality are required to be repeated every couple of years as individuals recertify. There has to be a recertification every couple of years. So once you're certified, there's a recertification every couple of years. But in order to move up to different levels, there's specific continuing education that's going to be required. We established a menu of like 14 different training topics that were largely part of the SAMHSA core competencies. We don't expect everybody to take all 14 topics, but we do want people to pick from training topics for the CEUs that they need to get for advancing through different levels. And I've kind of mentioned, I think that we didn't really expect everybody was going to be able to, or we didn't want to require that everybody had to take 14 of these courses. But they're all important, so we didn't really feel like we could single some out and not others. Okay, so work experience. So for Peer Support Associate for the entry level, there are no prior hours of work experience required. You can come in to a position and apply for certification without any certain hours of experience. You do need to take the required ethics and confidentiality and infectious disease courses, as well as the 40-hour course. For Peer Support Professional 1, it requires you to have achieved 1,000 hours. Just a clarification too about work. The work needs to be work as a peer support provider. I think that there's some, it's important that it be not just any work, but work as a peer support provider. So for level 1, 1,000 hours are required, which could be 6 months if you're full-time, or a year at half-time. For Peer Support Professional 2, 4,000 hours are required, which would be 2 years at full-time. And for peer support professional 3, 6,000 hours are required, which would be 3 years full-time. There's a requirement for supervision. It's referred to in the matrix as a practicum. But the understanding is that peer support providers should be working under supervision. So for peer support, you don't have to have previous hours of supervision to become certified at an associate level. But obviously, once you're working, we expect that you would work under supervision. For people to be able to be certified at the level 1, it requires 25 hours of direct supervision. And the supervision can be, it can be face-to-face, it can be telehealth, it could be telephone, it could be individual, it could be group, but it is important, that people are getting certification, particularly early on in the process. For level 2, it would require 100 hours of direct supervision in order to be certified at that level. And for level 3, it requires 150 hours. So the supervision can be provided by any individual who is in a designated role as supervisor within an organization that provides supports to individuals with behavioral health issues. So this can be, a traditional sort of treatment agency. It can also be more of a recovery oriented agency. So we would like for supervisors to get training and being a peer support supervisor. But at this point, there's really limited access to this training, so we're not really having that as a requirement. We will be developing training for peer supervisors, though. So there is no exam for certification, just satisfaction of the requirements for work hours and hours of supervision and the required training. So eligible work sites, kind of mentioned this already. We understand that not everybody that is working as a peer or wanting to work as a peer is going to necessarily work in a traditional treatment agency. And so there can be non-treatment agencies that would be eligible work sites as well. But they need to be providing behavioral health supports is really sort of one of the sort of core missions that the agency has. There's a code of ethics for peer support professionals. And we looked at the Alaska Peer Support Consortium Code of Ethics and also the NADAC, National Certified Peer Recovery Support Providers Specialist Code of Ethics. And we did a combination of a number of different aspects of both of those codes. So we also realized that people have been, there's a number of people that have been working in the field already as peer support providers. So we wanted to acknowledge that. So we created a special grandfathering, or we're calling it grandparenting application. And so there's a matrix that we'll go through of the requirements for grandparenting. And also there's a capacity for people coming from other states to apply. So we have a reciprocity application. For peer support certification, they will use the same type of application questions around background issues that the commission has used on other certifications, like the CDC. And so for individuals answering yes to any of these questions that, sort of raise some type of flag around background issues, they'll be required to write to the commission explaining circumstances and reasons why that is definitely behind them. So individuals that do identify a barrier crime will need to go through the background check unit process if they haven't already. And so if you're working with an agency that's already requiring this, you'll have gone through this process already. So with this, I am going to hand it over to Bobby. So Bobby, are you on?
Hello, everyone. Can you hear me, Jim?
Yep, you're good.
Awesome. So first, my name is Robert Dorton, but my friends call me Bobby. I'm originally from Northway. I'm an Upper Tanana Athabascan. I'm a person with lived experience from incarceration and addiction. I have been in long-term recovery for over 7 years. The idea of peer support, traditional peer support, when a group of like 20 participants, including myself, were going through the training to become a certified peer support specialist, one of the participants commented on how RADAC training talked about a specialized field for traditional counselors. I also went through that RADAC training and quickly understood, or at that RADAC training, I quickly understood that what that participant was talking about from being in RADAC training. And it got me thinking outside the box, like, what about traditional peer support then? And it challenged me to look at what traditional peer support could do for our elders who would want to offer their wisdom, experience, and support to others. Next slide, please. So traditional is a way of life that includes values and culture. When Indigenous people who have lived experience of behavioral health disorders share their experiences and their traditional wisdom with another person, it can be very powerful. Next slide. Traditional peer support specialists will work with the guidance of elders and village councils. They will use the guidance and their own personal knowledge and experience to serve with integrity and positive role models in their communities. So this is what I wanted to present today. Also, I'll tell you a little bit more about myself. I'm living here in Fairbanks. I'm working for Fairbanks Native Association, and I'm doing a lot of other things in the community. And I work with the Fairbanks Reentry Coalition as a co-chair for the Fairbanks Reentry Coalition, and I do a lot of other city stuff, volunteer work. But I think one of the main things that drove me to this is like my lived experience, and what it has done for my life is it's actually given me some tools to help others in their journey with peer support and with other work that I do. Lived experience is extremely important, and if you see me out and about, usually I'm talking to people about peer support and about the importance of peer support. Peer support is taking it to another level in my eyes, because when I work with clients or consumers, they give me a lot of feedback on how they can relate to me and how they feel like we're on a level equal level playing of sitting across the table from, so to speak, from each other and talking with each other, sitting at the same table. And that has caused them to potentially be more honest, willing to ask for the help that, you know, that they might not have asked if it was just somebody that didn't have the same experiences that they have. So this has been a really a nice tool to have in my toolbox. And I just wanted to emphasize that because it's really important to share what peer support has done for me. And like I said, if you see me around, you'll hear me talking about peer support. I just would like other agencies to fall into order with this and bring this into their agencies, because once you do that, I have a little joke over at our work. I said, if you get the floor monitors to become peer supports, it's almost like the floor monitors are on steroids, because now they have a lot more to work with when they're working with the clients or the consumers. That's all I got. Thanks. I'll turn it back over to you, Jim.
All right, thanks, Bobby. So we're gonna actually switch to Will Fanning, who is going to go over the matrices. So let me get the matrices up. Okay, so Will, are you on?
Yep, thank you, Jim. Okay, so I'm going to go through the different matrices, starting with the non-degree track. So I'm going to move from left to right across the screen, talking about the different levels. So for the first level here, which is peer support associate or traditional peer support associate, and moving to the side here with education, there is not an education requirement for the peer support associate or traditional peer support associate. Again, this level is an entry-level position that was created with very low barriers to get people involved and get that entry-level certification. Moving across into peer support professional 1 or traditional peer support professional 1. The education requirement will be a high school diploma or GED, with a possible waiver for traditional peer supports, like Jim had mentioned earlier, given certain circumstances. Peer support professional 2 and traditional peer support professional 2 and peer support professional 3 and traditional peer support professional 3 will also have a high school diploma or GED requirement, and again, potential waivers for traditional peer support professionals 2 and 3, given certain circumstances. Moving on to work experience. And as Jim had mentioned, to emphasize what work experience is, it is paid or volunteer work as a peer support provider within a behavioral health organization. With the peer support associate or traditional peer support associate, there is not a work experience requirement here. Peer support professional 1 and peer support professional, traditional peer support professional 1, work experience requirements are 1,000 hours. Traditional peer support professional 2 and peer support professional 2, it is 4,000 hours. And then peer support professional 3 and traditional peer support professional 3 will be 6,000 hours. The practicum requirement for each level, the peer support associate and traditional peer support associate will not have a requirement for this level. Peer support professional 1 and traditional peer support professional 1, the practicum requirement is 25 direct supervision hours, with the practicum based on SAMHSA core competencies for peer support workers. And that would include understanding the peer support role, engaging peers, providing support, share own experiences of recovery, personalized peer support, supports recovery planning, links to resources and supports, health and wellness skills, helping with managing crisis, values communication, collaboration, and teamwork. Leadership and advocacy, promotes growth, development, recovery orientation, and addressing trauma, social inequities, and health disparity. Moving to peer support 2 and traditional peer support 2, the practicum requirement will be that of 100 cumulative supervision hours. So this will be an additional 75 hours to add it on to the previous levels. Again, practicum will be based on the SAMHSA core competencies for peer support workers. Moving to peer support professional 3, or traditional peer support professional 3, practicum requirement will be 150 hours cumulative. That's an additional 50 hours of direct supervision from the previous 100. As this is more of a supervisory or mentoring role, the practicum is based on developing capacity to teach the SAMHSA core competencies for peer support workers. Next slide, Jim. So the training hours for each level. So the first level here, again, moving from left to right, will be the peer support associate or traditional peer support associate. The training requirement here will be 50 hours, and the required content of classes and hours will be the Division of Behavioral Health approved Intro to Peer Support course, which totals to around 37.5 hours, roughly. You will also be required to take 3 hours of ethics, 3 hours of confidentiality, and then 6 hours of infectious diseases, HIV/AIDS. The renewal requirements for each level of certification is for every 2 years. And then within that, you need an updated ethics class of 3 hours, confidentiality, and then 9 hours of CEU electives. Moving on across the screen to the next column, which will be Peer Support Professional 1 and Traditional Peer Support Professional 1. Training requirements will be 65 hours, and that will include all of your peer support associate requirements plus 15 additional hours from any of the following topics: recovery principles, communication skills, suicide prevention, harm reduction, crisis support, cultural competencies, trauma-informed care, recovery action planning, wellness, health management, motivational interviewing, documentation, peers in criminal justice, recovery capital, recovery advocacy, client rights, intro to mental health or mental health first aid, and intro to SUD. Again, the renewal requirements are the same as we previously mentioned. Moving across to the next column, which will be Peer Support Professional 2 or Traditional Peer Support Professional 2. Training requirements here will be 115 hours. So that's all requirements of previous levels, plus 50 hours from, again, the topics we had mentioned. And then moving on to Peer Support Professional 3 or Traditional Peer Support Professional 3. Will be training hour requirements will be 155 hours. That to include all previous levels plus 40 hours of the following topics. 20 of those hours to include leadership or supervision or supervising peers, and then 20 hours from electives of your own choosing. And again, renewal requirements stay the same for every 2 years. Each level of certification will require references, and for the peer support associate and traditional peer support associate. One personal reference is only required. Moving to peer support professional 1 and traditional peer support professional 1, one professional reference is required as well, and this can be from a supervisor. Traditional or peer support professional 2 and traditional peer support professional 2, one professional recommendation plus one supervisory recommendation are required here. And then peer support professional 3 and traditional peer support professional 3, one professional reference plus one supervisory reference. Fees and certifications for each level. Fees for the peer support associate and traditional peer support associate, initial fee will be $180, and then for recertification will be $165 every 2 years. Next. Oh, sorry, Jim, I don't think I had finished there. Thank you. For the peer support professional 1, the initial fees will be $195 with $180 every 2 years. Peer support professional 2 and traditional peer support professional 2, initial fees will be $210 with $195 every 2 years. And then peer support professional 3 and traditional peer support professional 3, initial fees $230 and then $215 every 2 years. Okay, next slide. Okay, moving on to the degree track matrix. And again, moving from left to right, peer support associate and traditional peer support associate levels for education. The requirement will be an associate degree, bachelor degree, or higher in a related field. And that education requirement also is extended across peer support professional 1, 2, and 3. For work experience, again, like we had mentioned earlier of what work experience is, again, paid or volunteer work as a peer support provider at a behavioral health organization or organizations. There is no work experience requirement for peer support associate or traditional peer support associate. Moving on to peer support associate 1 and traditional peer support associate 1, you must be employed at least for 3 months at your agency to count for work experience. Peer support professional 2 and traditional peer support professional 2, work experience requirement will be 2,000 hours. And then peer support professional 3 and traditional peer support professional 3 will be 4,000 hours. Practicum will be for the traditional peer support associate and peer support associate. There will be no required practicum for this level. And then moving across, practicum for peer support professional 1 and traditional peer support professional 1. 25 hours of direct supervision, again, all based on the SAMHSA core competencies. Peer support professional 2 will be that 100 hours of accumulative with 75 additional direct supervision hours from your previous level. And then peer support professional 3 will be 150 hours accumulative with 50 additional direct supervision hours from your previous level. Next slide, Jim. Thank you. So the training hours for the degree track, peer support professional, peer support associate, and traditional peer support associate. The training hours will be 50 training hours, and again, those required classes and content must be an approved DBH intro to peer support course, along with ethics, confidentiality, and infectious diseases, HIV. And again, like we had mentioned, the renewal requirements are for every 2 years with updated ethics, confidentiality, and then 9 CEU electives, and that will be across the board for each level. Moving on to peer support professional 1 and traditional peer support professional 1. Training hours will be just 50 hours with no additional hours needed. You will need all your peer support associate requirements, training requirements. Moving to peer support professional 2 and traditional peer support professional 2, training hour requirements will be 75 hours, which will be all your previous levels, plus 25 hours of topics we had mentioned in the previous matrix. Peer support professional 3 and traditional peer support professional 3 will be 95 hours of training requirements. That will include, again, all previous levels, plus 20 additional hours with the topics being supervision, leadership, or peer support work, supervising peer support work. References here, again, the same as the last matrix, one personal reference for the associate level. For level 1, one professional reference, and it can be a supervisor. Level 2, peer support is one professional reference, one professional recommendation, and one supervisor recommendation, and then one personal professional recommendation and one supervisor recommendation for level 3. Fees and certifications for the degree track then. For the associate level, initial fees will be $180. And then for recertification every 2 years, $165. Fees initially for level 1 will be $195 with $180 every 2 years. Level 2, $210 initially with $195 every 2 years. And then for level 3, initially the fees will be $230 and then $215 every 2 years. Next slide. Okay, moving on to the grandparenting, as many people will be who are already working in the field will probably use either the grandparenting non-degree track or the degree track. So moving again from left to right, peer support professional 1 and traditional peer support professional 1 for work experience here will be 1,000 hours. Peer support professional 2 and traditional peer support professional 2 will be 4,000 hours. And then peer support professional 3 and traditional peer support professional 3 will be 6,000 hours. Education across the board will require a high school diploma or GED, and again, possible waivers for those applying for traditional peer support professionals. For training, you'll see here that the required content, and again, it'll be a little different here for the different levels. For the peer support professional 1 and traditional peer support professional 1, the requirement is to have, again, the DBH approved intro to peer support course, or people may have taken a different 40-hour course prior to these other more local courses that have been taught here over the last year or so. So the training for these various different training entities, such as Rhode Island International Peer Employment Training, the Depression Bipolar Support Alliance, peer specialist training, intentional peer support training, VA peer support training, McShin Foundation, or the National Certified Peer Recovery Support Specialist training. Ethics and confidentiality must be taken within the last 2 years of your grandparenting date. And then infectious disease or AIDS training, HIV AIDS training must, again, is another requirement. Again, moving on to peer support professional 2 and traditional peer support professional 2. There is not a requirement for the 40-hour training here, but you must take your ethics and confidentiality training, as well as infectious diseases and HIV AIDS training courses within the last 2 years. And then for peer support professional 3, again, 40-hour class is not required. However, you must take those classes as well within 2 years of your grandparent date. The renewals are the same for all the different matrices. Again, it's a 2-year renewal with ethics, confidentiality, and your 9 other hours of CEU electives. References for this one, for the peer level 1 will be 1 personal reference, and this can be from a supervisor. Peer support professional 2 and traditional peer support professional 2 will be 1 professional recommendation plus 1 supervisory recommendation. And then for peer support professional 3 and traditional peer support professional 3, it'll be 1 professional recommendation plus 1 supervisory recommendation. Fees, initial cost for level 1 will be $195 with $180 for every 2 years. $210 initially for level 2 with $195 every 2 years, and then $230 initially for level 3 with $215 every 2 years. Next slide. Okay, and then grandparenting for those on the degree track, the peer support professional and traditional peer support professional level 1. Again, similar to above, the work experience will need to be 1,000 hours for level 1, level 2, 2,000 hours, and then level 3 will be 4,000 hours. Education, again, will be need to be an associate degree, bachelor degree, or higher across the board. And then the training and required classes will be the same as we had mentioned above, with those level 2 and level 3 certification levels needing to only have ethics, confidentiality, and infectious diseases. Renewals, again, will be the same across the board. References, again, same as we had mentioned above, and it looks like those fees are the same again as well. I believe that's it, Jim.
Yeah, thanks, Will. So I'm going to shift to, we're going to be talking about with Marlene and Dabney about some of the resources on the website. So let me go over to their section. If I can find it. Oh. I guess we're Okay, there we go. So Marlene, you're up first.
Yes, good morning. This is Marlene, the Certification Program Coordinator. One of the things I have, while I have a moment, I wanted to mention our website is under construction and should be complete by the end of the month. So while I may mention these items, they may change by the end of the month. Anyway, on our website, we'll be having both the manual and training resource guide to assist applicants as they prepare applications for submission to the peer support program. The peer support manual is located on our website at the Alaska certification.org. It summarizes information about submitting an application for certification. It provides information on how to submit an application, a sample application, fees for the certification, the code of ethics, information on ethics complaints, and more. The training resource manual has over 10 pages of resources for training to support the peer support professional in meeting their training requirements. This is a guide, but is not intended to be a comprehensive list. In other words, there are many more training opportunities on the webs, anywhere on the website. The title of training, the number of hours of the training, the website address, and a short description of the courses are listed in the initial pages. Other organizations who provide training are listed in the last pages of the manual, and this will be updated as more trainings become available.
Good morning. My name is Dabney, and I'm the Executive Director for the Alaska Commission for Behavioral Health Certification. It is my duty today to talk to you about the applications, exactly how you can access the applications and work with them. And so to start off, like to suggest that you first take a look at the matrices, which will just explain to you to decide which application you would, for which certification you qualify best, so that you can start with that. And many of you will want to start with the grandparenting application. This application is slightly different from all of the rest in that it is constructed so that no matter whether you want to apply for grandparenting for peer support professional or traditional peer support professional 1, peer support professional 2, or traditional peer support professional 2, or peer support professional 3, and peer support traditional peer support professional 3. All you need to do is to follow the instructions that are in the application for each different type of certification. Then when you go to pay for certification, then you only need to click on one button, and that one button will be the button for the certification for which you are applying. So if you're applying for peer support professional 1, you click on peer support professional 2. Now I have great news here in that the commission has just received an amendment to our contract from the Division of Behavioral Health so that we can offer the first 218 applications, people who apply for grandparenting or apply for any of the applications, we can offer a $75 discount. So when you press that button for your certification, you will automatically receive the discount price. So instead for peer support for the peer support professional 1, instead, the price for that will be, instead of 195, the price for that is going to be 105. Or that might be for the peer support associate. Anyway, so there is definitely a discount. And so for the peer support 1, the cost will be $120. So please take advantage of that to send applications, and that we will have that special on between now and June 30th. However, it is for the first 218 applications. Therefore, the special might expire prior to June 30th, 2021. Now I'd like to take a look at all of the rest of the applications, and we can do that by going to the next slide, which offers a checklist. All of the, actually all of the applications basically have a general information form, an applicant's attestation of lived experience and recovery, a training log, background disclosure sheet, code of ethics signed and dated, authorization for data collection, and completed training certificates. We request a clear and legible copy of your driver's license or picture ID, current resume, and then for peer support 1, 2, and 3, there will be practicum evaluations. And you will also, for peer support 1, 2, and 3, have references that need to be submitted. Also, I don't know that's mentioned here, is also there will be on peer support 1, 2, and 3, traditional peer support 1, 2, and 3, there is an employer verification of experience. And this is also on the grandparenting applications too as well, because we want to find out about your work experience, whether or not it is, and it needs to be peer support work experience that is listed on that sheet. Just because you have worked with an organization for several years does not mean that you would automatically become a peer support. It needs to be peer support work that you did during that time period. We want to stress that, especially. The applications are located on the website at this time, and you can download them from the peer support page. There is a button called Forms. Under Forms, you will find all of the applications to use. And then you will also find buttons for the manual, the training manual, as well as the training guide. And I hope you will take advantage of those resources. And as Marlene explained, we will be highlighting other training opportunities on the website. Both, we will also be sending everyone trainings as we receive them too as well. I think that is about all we should say right now, because unless we can have time for questions and answers. Jim, would you like to lead us in that?
Yeah, so folks, if you have questions, and we hope you do, we have plenty of time for them, to put them in writing in the chat window, and we will start reading those. And I'm going to put up contact information for the commission here. So, I'm going to ask, I guess, sort of Will and
Yep.
Marlene or Dabney to keep track of the questions.
Yeah, I can just keep going with them, Jim, if you like.
Okay.
All right. So first question here I see, can you tell us more about the qualifying educations for advanced peer support level 3 or 4? For example, will RAP and or WAM facilitator training qualify? Or how about peer wellness coaching training, such as they offer in Oregon?
So I guess I understand the question being around whether those fit into the topics or not for training, and the 40-hour course in most cases is going to be required, and that's a specific course. But those 14 topics, I think, are going to cover what you're referring to. So those would certainly count towards the, the hours that you would need for a certain level.
Next question, can an agency bill Medicaid for peer support services if their peer staff have not been certified? If no,
And,
I'm sorry, go ahead, Jim.
Well, are you continuing with that question?
Yeah, and if no, can an agency hire a peer support specialist who has not taken their initial 40 hours peer support training, and is there a grace period for the peer to complete their required training?
So right now, if you're working in an agency that can bill Medicaid, behavioral health Medicaid, and you're not certified, that's fine. For the 1115 Medicaid services, agencies have to do a special enrollment to provide those. And as part of the SUD peer support, it is required that within 3 years, you'd be in a provisional status in terms of being able to provide services. Within 3 years, you'd be expected to become certified. And the mental health side of it is essentially follows the SUD requirements.
Got it. For the grandparenting peer support 3 and grandparenting traditional peer support 3, is the intro to peer support course required? And is there a discount for applying for both certifications at the same time?
This is Dabney, Will. I'd like to answer this question because I have received an email from several other people requesting the same thing. The traditional peer support, the traditional peer support professional and the peer support professional are basically the same certification. Therefore, for anyone who wants to become a combined peer support professional / traditional peer support professional, we will ask them to apply for one of the certifications, but to let us know that they would like to be traditional peer support professionals or peer support professionals, vice versa, whichever, as well. And we will send them a certificate that says both, okay? Because they are basically, they're basically the same certification. Only in the very beginning, there are actually more competencies that the traditional peer support professional has than the regular peer support professional. And if they And if they would like a copy of the first page of the traditional application, they can receive those, or we can send them to them. And I'm sure that they are well aware of them. They are just as Bobby Dorton described them.
So, Will, there might have been a different part of that question at the beginning that, can you repeat?
Yeah, so there is the Intro to Peer Support training course required for grandparenting and peer support 3, level 3.
No,
No, not at this time, but no, not, we are not, once you are applying for a peer support 2 or a peer support 3, we understand that you have enough experience and training by that time. And we also, but however, if you have already taken a McShin training, if you have already taken the Rhode Island training, if you have already taken VA training, or if you have already taken the Peer Support 1 training, please do send the commission your certificates so that we can give you further credits.
for grandfathering level 2 and 3, the 40-hour course is not required.
Next question, can direct supervision be provided as a group?
Yes.
For the 3 CUs for updated ethics requirement, what is the guidance for the content of this training? Should these trainings be peer focused, or do other ethics CE trainings for behavioral health professionals work for this requirement?
You know, that's a really good question, but we hadn't specified that they have to be peer oriented. I think that there's great value in being able to get a course that is peer oriented. The fact is that there aren't a lot of those courses to be found, but you know, any ethics course will be eligible. Is that right, Dabney?
That is correct. And yes, by all means, if anyone would like to put together a peer support ethics class, that would be wonderful.
Okay. And I think you guys answered the last part of this question, which was, does this training already exist that meets the requirements? I think you guys answered that. From the time a peer support specialist starts work with us, how much time do they have before they need to submit their certification?
I think that there's really not a time frame with that. I think that you have to, in terms of your own organization, it would be a matter of kind of where your organization is at as far as how quickly they want you to be certified. If they're an 1115 organization, there is that 3-year period from the point that you become an 1115 provider, an individual provider, that you would need to become certified.
If an organization is interested in developing or certifying as an existing peer support training, what is the process?
So, you know, for the 40-hour training, if anybody's interested in becoming a trainer for that, they would need to look at what the guidelines are. Probably the best thing is really to contact me, and that's james.mclaughlin at alaska.gov. You can go to the DBH website and I think find my email to work with me around that. There's in terms of really some of the other trainings, there's not any type of a particular pre-approval that you need. but I think Dabney might talk a little bit about what they look for when they get trainings in terms of the commission approving them.
Yeah, it might be helpful, Jim, to write your email in the chat.
Yeah.
Next question, how do we get a copy of the matrices that were presented today?
They, well, number one, in the portal for Alaska Training Cooperative, how you registered should be available. But they would be available on the website, the commission's website. Is that true, Dabney?
Yes, that is true. And can you hear me?
Yeah.
Okay, and they also might have been given out at the, as a handout. I'm not sure whether Diana put them in as a handout section, but they might refer to the, I'm not quite sure how you refer to handouts for this webinar, but I think handouts were supposed to be available for this webinar.
Yeah, and I think the best bet, is for sure you can get them off the commission's website.
Yep. There's a couple of parts to these questions. Next question, what services can the associate level peer support specialist bill for?
That's a question that you need to work with your agency to look at.
Okay. What is the cost for training? I'm assuming this is the DBH approved intro to peer support training.
So there's some training that we're able to fund, and that training would be without cost. But the trainers, if they are not funded to provide particular training, it would be really sort of their businesses, and they would be identifying what the cost is and whether, a particular agency or individual, they would identify what the cost is for it.
Okay, and can you provide a definition or explanation on what constitutes direct supervision and who can provide it, provide direct supervision?
So when we spoke before, I'm going to try to get the slide up again. When we spoke before, direct supervision, it's obviously provided by someone within your organization who you're working with as a supervisor, who's designated by the organization as a peer supervisor. The organization can be either a traditional treatment organization, or it can be a more recovery-oriented organization that has one of its core services providing behavioral health support. The supervision itself can be one-on-one or group, face-to-face, or it can be by video. And Dabney, I think we even said it could be by telephone as well. Is that correct?
Yes. Yes, in the past, there have been teleconferences, and some of those teleconferences do provide continuing education hours. Therefore, we would need a certificate for the training that would list the date completed and the number of continuing education hours given.
Okay. Next question. Given that many employees in this field move from agency to agency, how will the work hours be tracked? What verification will be needed to prove the hours happened?
And Dabney, I think I'm going to ask you to respond to that. Did you catch that?
Jim, I think, can you hear me?
Yeah.
Okay, we can't see you or anything here. Something happened. And I'm trying to get you back. What was the question?
Given that many employees in this field move from agency to agency, how will
Mhm.
work hours be tracked? What verification will be needed to prove the hours happened?
The hours need to be tracked by the employer. Therefore, it is the employer that needs to say these were peer support work hours. That's generally how we look at it. It is not just by the supervisor. The supervisors do move around to different agencies, as well as the employees move around to different agencies all the time. And so what we do, if we find that the applicant only has, let's say, he's wanting to apply for peer support 2, which requires 4,000 hours or 2 years of experience, peer support work. But his current employer, at his current employer, he has only worked for 6 months. Then we will require him to send an employer verification of experience form to another employer, to a past employer, to document the hours. And if we do not get that, then that person will not be able to move to peer support 2.
Got it. Okay, I'm curious to learn more about what type of behavioral health services an agency would need to provide in order to be able to supervise a peer support specialist. We work in the recovery realm, but more in a prevention and advocacy. Looks like this person is Tiffany Hall from Recovery Alaska.
Mhm.
Is there any way we could potentially staff a peer support specialist?
Yeah, thanks for that question. Yeah, I think it's, whether the, I guess whether the agency is really providing individual support services, behavioral health supports to people. So the peer support person needs to have experience working individually with folks. So that should be part of what the organization does. And it can be in a number of different types of ways that they provide support, whether it's a drop-in center or another type of work, but the work should be providing individual support to folks with behavioral health issues.
In general, for the additional hours for training required for traditional and peer support professionals level 2 and 3, do we know that enough training exists already to support this? Should these training be peer focused, or do other CE trainings for behavioral health professionals work for this requirement?
So I think that I'm trying to pull up that particular trick. But in terms of the list of 14 topical areas, that are driven by SAMHSA core competencies, there's a number of sort of online types of resources that are provided as part of the resource list that is on the certification, the Commission's website. But the reality is that we really are trying to develop more local trainings, along these lines. And there are some that exist now. I think that there will be more in the future as the demand increases for these topics. But there is a resource list in terms of where you can go to get some of these trainings.
You kind of answered the second part of that question, Jim, but just one other question. Is there funding to develop these new trainings?
At this point, no, but I think that that's certainly something that both the division and the trust are interested in.
Okay. Are there general set criteria for prior work experience, or is it evaluated individually? Are there general set criteria for prior work experience, or is it
right? Well, the criteria for work experience is that it's really working in the role as a peer support provider. It's going to come down to your employer in documenting those hours as peer support hours, and making determinations about that.
And then the peer support, traditional peer support application process involved the locally federally recognized tribe to verify traditional knowledge.
We've not established that as any type of verification.
Okay. On becoming a training provider, does this require the agency to be recognized as a training provider by the ACBHC?
In terms, well, I guess there's two parts to that. One is really the 40-hour training. And for the 40-hour training, that needs to be approved through the division, and the commission really sort of has that really established, and it's in the matrices that it has to be a DBH approved provider, training provider for the 40-hour. There isn't an established provider or sort of any vetting of training providers for the other topics and the other CEUs. But Dabney, you might want to weigh in a little bit in terms of what the commission looks for in terms of those trainings.
The commission wants to make sure that the training is given by someone who is knowledgeable in the course that they are teaching. They are usually LPCs or licensed clinical social workers, or peer support supervisors, or other persons who are knowledgeable in the areas of recovery and in the areas of the different types of trainings that are offered and that are required for peer support. The RADACT is an organization. That's the Regional Alcohol and Drug Abuse Training Organization here in Alaska. And there are many different instructors that teach those courses, and all of those courses will fit some of the areas that are covered under peer support.
Okay. Under the 1115, I was unsure if the peer support H0038 code is going away. Will they be billing intensive case management or CRSS?
I think we'd defer that to your agency, and any discussion, particularly with the Medicaid part of DBH.
is my understanding correct that if we want to apply for both a peer support professional 3 and a traditional peer support professional 3, we just need to apply and pay for one of them and just let you know that we would like both?
This is Dabney. That is correct.
Okay, moving on. Is there a required number of hours per year to be a peer support specialist? Could someone just do it as a small portion of their job, so long as they maintain the certification requirements at the lowest level?
In terms of, once they've been able to be certified, there's not a requirement for a particular number of hours of work during the course of the year, or it's really, I think, in terms of being recertified, it really is a matter of the training and then the work hour part of it, or the additional hours of work hours only comes into play when you're applying for another level.
Okay. I believe that's all the questions that I see here.
Okay, well, maybe give it like one more minute in case it has a late breaking thought that they wanted to ask. Otherwise, we really appreciate all the questions. I think if there are some that we've answered that still aren't clarified, you can contact the commission, and we'll continue to. We're going to put together a frequently asked question list on the website, and we'll continue to refine that as other questions come in.
Jim, can people contact you directly to ask questions as well?
I'd suggest that they go straight to the commission, and then, but I work really closely with the commission.
Got it.
So, and not seeing any more questions, I think that we're about to adjourn, but thanks everybody. And we're pretty excited about this. It's great that there's a discount on the certification fees for the next number of months. We just hope that people take advantage of this program. So